Hello and welcome to How to Survive Healthcare. I am Kayla Thompson Riviere. I have over a decade of experience as an RN in the ER and ICU. Now I'm helping people as a dedicated advocate.
And I'm Nicole Broadhurst, a healthcare billing specialist and financial advocate, here to make sure you're not paying more than you owe.
We're here to share the insider tips and tricks you need to navigate the healthcare system, avoid common pitfalls, and get the care you deserve.
Because no one should feel lost or overwhelmed when it comes to their health.
Now, it is important to note that the information we share on this podcast is based on our experience and research, but it's not intended to replace professional medical advice. But whether you're a patient or a caregiver, you're in the right place. Hey there, welcome back to the podcast. Today, we're going to talk to you about a plan for the new year, because I'm sure you've had this experience before. If you don't plan out your time just rolls all over you. There's a better way to say that. There's a saying. Can't think of what it is.
No. Oh, if you fail to plan, you plan to fail.
There's that one. But there
I don't know another one.
We'll add this to the bloopers. So if you're listening to it, write in and tell us. That'll be super helpful afterwards. Maybe I'll come up with it as we're talking.
I love it.
But anyhow, when we talk about moving into the new year and New Year's resolutions, oftentimes we do hear them around health. One of the biggest ones I think we all hear is losing weight. But I don't always hear about New Year's resolutions or even planning out your year with regards to healthcare and making a plan for how your appointments what appointments you need to be making, surgeries, and then thinking about your deductible and your out-of-pocket expenses. So that's just where we want to kind of shine a light here today. Making a plan for your healthcare year and for your loved ones will help you to feel a bit more in control, a little less overwhelmed. And we all know that an ounce of prevention is worth a pound of cure. So putting a plan in place can help us to squash down some of the things that maybe would have popped up if we hadn't planned around them first.
Love it. I love it, Kayla. It's really interesting. We were just talking before we got started here. I was actually doing a little bit of this planning impromptu this morning on my morning walk. Specifically, I was thinking about my annual appointments. And currently, my doctor likes to see me every 6 months. My real goal for 2025 is to get that down to just the annual exam, right? That wellness exam, so that she doesn't need to see me between. That would be great, because first of all, if you only need one visit with your PCP because everything is good, then that's considered preventative, and there's no out-of-pocket expense on it.
Ding, 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 ding.
Right? So that's my goal for 2025.
The flip side of that is that your annual exam is preventative and there's no out-of-pocket expense. So make sure you're going and that you're following up to get your labs drawn. And if you're in that bracket of healthy and no medical problems, we want to keep you there, because remember, the sooner we catch something kind of going out of the range of normal, the easier it is to curb it and put it back in and keep you in that healthy, disease-free bracket.
Yeah. All of that, Kayla. Yes. So I was actually specifically thinking about my annual exam is in January, and then my 6 month is in July. So on my walk this morning, I was thinking, does that still work for me, or do I want to move it a little bit, like to March and October? I haven't made a decision yet on that, but I still like having the first one early in the year, because if I've done my job, my part on this, then maybe I won't have to see her again until January of next year.
That would be so exciting.
Right? I would be stoked about that. So the other thing that I like to think about is, what worked last year? So last year I had some screenings that were due. Once you get to a certain age, there's some screenings that you need to get done. And some of them are annual things. So be thinking about those things. Like, what do you have coming up that needs to get done? Maybe didn't get done last year, or it's just due this year. But be thinking about those types of things, specifically anything that's preventative, because again, there's no associated out of pocket expense with those. So, think about what worked last year. Did you miss some appointments that you need to get done? Those types of things. Because reflecting
Yeah.
really helps you plan ahead and stay in control of those bills. Now, from a financial perspective, I also like to look at what was my annual spend last year, right? And was there
Did you
anything
hear that,
out of the
guys? She
normal?
likes to look at that.
I do. I do. In fact, my husband asked me just the other day, he was like, "Hey, did you check that out?" Yes, actually I did. And we currently, so for the last 3 years, we have been pretty stable in our medical expenses, which is really good. That feels good, right? Like, okay, that's great. Is there is there anything that I can do in the coming year to kind of reduce those? Specifically, we're looking at some medications. So I have a plan to talk to my doctor in January and ask, there's 2 medications that I'm on that I think it's going to come off.
Mm-hmm.
Mean, that will save us a little bit of money. And because I've been working really hard over the last year, I think that that's a reasonable request from a health perspective. So those are some things that you can think about reviewing last year and then planning into this year, into 2025.
Absolutely. And on the topic of medications, I just want to point out that typically your provider is prescribing you the medication that they think is going to work the best for you. That doesn't always take into consideration, often doesn't take into consideration at all, what the out-of-pocket expense of that medication may be. And for some people, it's an unavoidable expense, but if you just have that open, candid conversation with your provider and actually start by looking at what is and isn't covered on your insurance and what the out of pocket is going to be, you may be able to switch to something that can work just as good or at least be good enough for the situation that you're in and perhaps significantly save you money every month. So this is a good time to review those things. Particularly if you are caring for that aging family member that does tend to come with a lot of prescriptions and expenses. Moving on with the topic of thinking about now not just yourself and your health things, but likely if you're listening to this, you have kids that you're taking care of and perhaps that older family member as well. And that can start to add up to be a lot of appointments, which can get really tricky if you're just kind of going about them willy-nilly and booking the appointment when the office calls you. I would really encourage you, if you are that person who is taking care of several people, to take a few minutes and sit down with your calendar for the year and start to map things out. Because as Nicole was mentioning, your annual appointment, sure, it can be in January, but maybe it can be in February. Maybe the kids can get seen at the same time, even if they're each maybe a month off. Maybe you need to look at when dad's colonoscopy needs to be, because if it's the same week that you need to have a mammogram, that's going to be really challenging to schedule. So starting to look at all of these things are coming up this year and then making a plan with where you can put them in will leave you some breathing room and not be so stressed with work and taking time off. And then you can book the appointments now. Booking appointments way ahead of time, you have more options about the timing of appointments. If there's a particular day of the week and time and you're booking 6 months out, you're more likely to be able to get that than if you're like, oh crap, I got to get them to the cardiologist. You're going to kind of be stuck with whatever is left. Obviously, health things change and necessary follow-ups are going to have to be made unexpectedly through the year, but the more we can plan for The more we can strategically plan out the things we already know are going to be there, then the less disruptive those pop-up events will be. Now, we've given you a lot of ideas for things to be thinking about, the checkups, the preventative screens, reevaluating medications. And I know that this can sound a little overwhelming. Nicole, can you touch on that at all?
Oh, yeah. So everything seems overwhelming to me in my life. I'm just going to put that out there first and foremost. Like, overwhelm is pretty regular, and I know that I'm not alone, right? There's a lot of us. There's a lot going on, and overwhelm can be a real thing. So really focusing on just one or two priorities that you want to focus on in the coming year for your particular health. So like I said, pick something and just make small, little, achievable steps. Because here's what we know about creating change. If I wake up in the morning and I try to overhaul my entire day and my life, I'm probably going to get overwhelmed, frustrated, and throw in the towel.
Right.
So it's much more important that we pick small things that we can actually implement and be consistent and develop a habit. What is it, Kayla? You and I talk about this a lot. Our thoughts become habits. Our habits become, what does that change? Anyway, I don't.
Oh, yeah.
Yeah. Anyway, the small things stack on top of each other. The thing that is coming to my mind is atomic habits.
Absolutely.
And how
Yes.
habit
Habit
stacking. Yes, this is one place to do that. So for me, you all know I'm a diabetic. So my A1C is something that I track. So I take my sugar, I check it frequently. My husband has high blood pressure. And so we're trying to do some things with him. And his little thing is to literally start taking his blood pressure at regular intervals and tracking it. Okay, because we don't know what's happening when he's not taking it.
Right.
Right? Is the medication working? Is it not working? What's happening? And if he wants to, because he has shared with me that he would like to get off one of those medications, need to know what's happening in order to make that request, right? So
yeah.
Be consistent. You can use, I love all the health apps. In fact,
Yeah.
I'm an iPhone user. And so the health app in your iPhone can tie directly to your patient portal and pull in some of these information and give you lots of good stuff. I track my steps and all kinds of things, a Fitbit, some kind of watch. There's all kinds of technology if you would prefer that over a notebook and a pen. So
yeah, even the notebook and the pen is fine. Again, if you're somebody more like me who you're like, okay, this sounds good, let me go pick an app, and then you go in the app store and there's like 20 different apps you can choose from. You don't know which one to pick. Like, just, it's okay. Step off that path.
That's right. So not
pen
a
and paper
hole. Absolutely
is just fine.
Yes.
Just
yes.
Start where you are and keep it all in one place. And if that system is old school or new school, it doesn't matter, but start with one thing, because, especially when you are caring for your loved one, there's probably a lot of things that you wish that could be changed or improved in their health. So pick the one thing that's going to make the biggest difference. Or if that thing is too big and you don't know where to start with unraveling it, pick one thing that you can focus on.
Right.
And if you need guidance with this, that's what advocates are here for. Reach out. I'd be happy to spend a little time with you to help you tease out, what is the highest priority, how to tackle it. Sometimes you can have those kind of conversations with your primary care as well. So that's an option too. But small, tiny, actionable goals, and you can always reevaluate. Personally, I like to every 3 months, every quarter, I'm reevaluating my goals, both personally and professionally. And okay, what's working? What isn't working? What am I able to implement now? A friend of mine, she actually does a new thing every month, which I'm like, for me right now, with everything I'm juggling, every month is too much. But all that to say, find a cadence that works for you and then plan and reevaluate, replan. That's how I approach things actually with my clients as well. It's a continual process of improvement in small steps because it's those, how do you eat an elephant?
Right.
One bite at a
One
time.
bite at a time. That's right.
It's those little small steps that actually get us where we want to and get us out of the overwhelm. But it requires making a little bit of time for a plan.
Yeah, that's right. I love it.
So I hope this was helpful for you. Take some time, get it out on a calendar, make a plan, and commit to just one small step and then reevaluate. Of course, we're always here if you need the help, howtosh.com, and you will connect with us and we will see you next week. Thank you. Thanks for joining us here on How to Survive Healthcare. We hope you found this episode helpful and empowering.
If you're looking for even more resources and personalized support, head over to how2sh.com. That's how2sh.com. There you'll find tools, tips, and ways to connect with us directly.
Whether you need help organizing your medical information, understanding a bill, or navigating a tough healthcare decision, we're here to help.
And don't forget to subscribe to the podcast, share it with someone who might need it, and leave us a review. It helps us reach more people just like you.
Thank you for listening, and we'll see you next time. Bye-bye.